Well, hello everybody, and welcome to In Conversation. This episode is another special edition of Intellect's regular podcast, brought to you in collaboration with Doctors Rupal, Shah and Jens Foell. Jens and Ru are the authors of Fighting for the Soul of General Practice, The Algorithm Will See You Now. Joining Ru and Jens on today's podcast is Dr. Emma Presern. Emma, wonderful to have you. Welcome to the podcast. Really appreciate you giving us your time and expertise today.
Thank you so much for having me. It's lovely to meet you all.
Well, I think our viewers by now probably are familiar with Ru and Jens, but could you just give me a bit of a brief introduction about who you are and what kind of medicine you practice?
Yeah, of course. So I'm Emma. I'm in my 30s. I'm a newly qualified GP, so I've been qualified for 1 year. I've been a doctor for over 10 years now, but it had a bit of a meandering path to general practice via Australia and a career break in 2021 during my GP training. So yeah, I'm finally qualified. I've actually left London. I was in London throughout my training and for my junior doctor years, and I've moved to North Wales to be closer to nature and the mountains. And yeah.
Thank you very much. Well, yeah, that sounds lovely. I'm a big fan of nature, mountains, and Wales, so I'm glad to hear about that. Did you always think you were going to end up being a doctor or working in the healthcare profession? It sounds like you kind of had a few moments of indecision along the way.
Yeah, I think it was instilled in me from a young age, probably many of us too young sometimes, but I always wanted to do something in the caring profession. I think I also grew up in countries where there was a lot of poverty and social inequality, and I think I always wanted to do something related to health and well-being. But over time, I've also realized possibly, maybe I was too young to make that decision. And I think a lot of us go into the caring professions as what I call wounded healers, and possibly going into a profession like this when you don't understand it yourself, you're searching for something within that. And that certainly played a role. It hasn't changed my sort of desire to stay within medicine, but it's definitely I've been able to reflect on my decision to become a doctor. And that definitely played a part. Which I've worked through.
Well, and as a young GP in the UK, to what extent do you feel that you sort of belong to the profession?
I think I've got quite a lot of mixed feelings about whether I belong to the profession at the moment. As I said, it's I'm only very newly qualified, and I think things are quite tough in the NHS at the moment, as everyone I'm sure will agree, both patients and the workforce. So, on the one hand, I feel quite proud that I've got to the end of my training and I've now entered the primary care profession. And I was quite excited about, becoming a GP for everything that it stands for. But there's a lot of uncertainty about our futures going forward. I think there's a growing sense of demoralization. And there's a recent survey that was done by the BMA, asking GP trainees about their sort of well-being and mental health. And I think 70% of GP trainees currently feel burnt out. And those sorts of figures are quite alarming, but to me, not very surprising. I was definitely one of those burnt out GP trainees. So I think, it's the current realities of the sort of workforce crisis, the healthcare system at the moment, the systemic issues that have led to the workforce crisis have made it a little bit more difficult to feel that sort of sense of belonging. I haven't worked in a practice for many years like some of my colleagues have. And I think that's protective in a way, in a sense, that community of being in a practice for a long time. I haven't had that yet. So it's really hard to kind of enter the profession at this stage, and you feel quite isolated. However, since opening up about my burnout and my feelings about the systemic issues that we're all facing, actually, there is a whole community of us that feel similar. And in some way that I feel a sense of belonging through that, because I know that there's a lot of people doing a lot of good work to try and solve things within general practice and within the healthcare system as a whole.
And when you talk about opening up about your feelings around burnout, can you just tell us a bit more about what that entailed? How did you do that? How did you open up about these feelings?
So I've only recently opened up about them within the last 6 months since qualifying as a GP. But looking back in hindsight, I burnt out from 2019 to 2021. It was a sort of slow, steady path, and then I hit my rock bottom. But as with many medics and probably healthcare professionals, we're quite effective at wearing a mask. So I don't think anyone around me would have realized I was burning out. I was able to go to work and give my energy to patients, but what that meant was there was nothing left for me at the end. And that sort of feeling of emotional exhaustion and thinking, is this it? Is this what my life as a doctor is like? Started to really hit me. But I was too afraid to open up back then, and I didn't know anyone else suffering from burnout. This was pre-pandemic and then sort of into the pandemic. And the way I dealt with it, alongside a lot of my own kind of healing and lifestyle overhaul to look after myself, was that I actually took a career break from GP training on an out of program experience. And I gave myself some time away from clinical medicine, which really helped me to sort of, I think, rediscover many parts of myself and my identities that I had lost along the way in the path to becoming a doctor. And that certainly led to a bit of a transformational period of growth in my life, and has made me realize that there are many other identities alongside the doctor identity that I want to pursue. And I think that makes people better clinicians in general. So I'm quite open now about that burnout that I experienced, mainly because I think it's really important to be vulnerable so that people don't feel like they're alone in how they are feeling.
Well, thank you, Emma. And I think that's really important. I think that many people listening will probably really appreciate your honesty. So thank you for sharing that today. And Jens and Ru, I'd love to bring you in here as well. You've obviously both been in the profession a bit longer. Have either of you experienced burnout? And, do you think since you joined the profession, have things got worse for young GPs? And, or do you think things are perhaps becoming more open and that there's more discussion and more support and services to support young GPs around issues like burnout and training issues? Ru, I'll just ask you what your take on that is.
I don't think I've ever been at a point of feeling burnt out, and it's hard to kind of know whether things are better now or worse now, but a couple of observations. So I think when I entered training, there wasn't this discourse about permission and what's allowed, and I think that is really in our just in the atmosphere now. Trainees are always asking me, but am I allowed to do that? Am I allowed to cry in front of the patient? Am I allowed to break this rule, this guideline? And when I came into general practice, NICE was relatively new. It wasn't the kind of vibe that it is now, and it didn't have the same dominance. So I think we had more autonomy. I felt like I had more agency as a young GP. I was allowed to kind of experiment in a way, which sounds terrible, but there wasn't this sort of same kind of level of fear about doing something wrong. I think it was more acceptable. And as things have gone on, I think I've been less affected than younger colleagues by the change in culture, because I've got, quite a lot of social capital within the practice, cultural capital, however you want to call it. In the sense I've been there, as Emma said, for a long time, 20 years actually. So I feel like people have my back. I kind of feel that I'm in a real community of practice. I really trust my colleagues, and that helps, I think.
Thank you, Ru. It's interesting because I'm a humble publisher, and I've been working for the same company now at Intellect for 16 years, which in my industry and in the culture industries is quite rare. But as healthcare professionals, you guys, you kind of make these decisions early in life, and then you train vigorously, and then you go through all these different hoops and processes, and then it's often like a life commitment. You just say, really been in the profession for 20 years. Emma's a young GP, but she's still been in the profession for 10 plus years. So Jens, how about you? I know you've been in the profession for a few years as well. Now, did you always know that you wanted to be a generalist, to be a GP, and have things changed from your perspective since you joined the profession?
They have tremendously changed. I was listening with interest to what you say, Emma, and also what Rupal says. The first thing is, I never experienced a kind of belonging to the profession, and I'm a doctor. For me, doctors was always them, but not us. My parents are not doctors. I saw the culture as an outsider, and I thought it's amazing that they haven't chucked me out yet. It will come eventually. I am not from, I don't have this ethos that I know everything and so forth. I come more from, I would say, healing, German natural healing, and so lots of rituals, quackery, I would say. But I feel comfortable with coming from quackery, and I know how to make people feel good when I'm alone with them. And I somehow managed to navigate doing all the exams at first in Germany as brutal exams, and now later as an educator here, I see it is, I would say, horrible what everybody has to go through, being monitored constantly. I'm doing a lot with students, and I think it is a job, and their job is being measured, monitored. Everything gets assessed in micro detail. That is such a work being governed. And it's almost a totalitarian, fear-driven system that you think, if I do it like the guidelines say, I'm safe, and you start using, or people start using, saying we, and as if you're safe, if you belong to this pixeled army of young doctors like in Lord of the Rings, and if you're part of them and your uniform, then it's okay. And I'm quite sad about that. And for me, I think it gave me strength, or seeing from the outside. I enjoyed working in London, where I'm a foreigner and I treat other foreigners. Nobody belongs there. That was quite nice. It it fosters curiosity and placing people on the globe and asking lots of questions. So I'm still on the quest, I would say, but time is slowly running out for me, because many people think about retirement, where I'm still thinking, where's the good place where I finally belong to? I I think temporarily I made it here to North Wales and built more and more relationships, and they're actually okay. But I haven't got this deep belonging, deep roots that is out of question. And I quite like it. I think I would fear if I would be really unquestionable, deep rooted like an oak and I'm a doctor, and if I'm not a doctor anymore, I can't live. No way. I live very well, and if I remember that's where I'm coming from, sometimes with a bit of a sadness, I'm not fitting in. I definitely not fit in. But that's okay. I don't know whether anybody really fits in. I don't know. Maybe it's a better idea not to fit in, and being aware what kind of adjustment processes you're making, than to seek a kind of unquestioned unity.
Well, and Emma, there's clearly a lot of alienation among the workforce in the medical profession, and I know we hear about crises where doctors are leaving the profession. Is there anything that you think would help prevent younger GPs from leaving the profession?
Yeah, I mean, what Ru, you mentioned there about how your sort of training into general practice and my experience really resonated, because, I recently wrote an article exactly about that, comparing our current NHS model to that of a sort of monocrop plantation or a factory farm medicine model. I feel like that is what we have been trained into, and it's certainly not what I envisioned with regards to primary care. And certainly speaking to older GPs and family friends and colleagues who have been GPs for years, that whole person medicine, that sort of community stuff, I think has been eroded, and we are trained into a model where there is that lack of autonomy now. We're kind of very much algorithm guideline driven. We don't know how much scope there is to try different things. I certainly tried within my training to implement lifestyle medicine, which is a passionate area of mine, but it was very, very difficult within the system, as you mentioned, when we have sort of paid to do boxes like quaff targets, popping up in every consultation. It detracts from what you're really trying to achieve within general practice, which is really a relationship and listening. And I think just holding space sometimes and being with patients. And I find that really hard to practice in that model. Our society is so much more complex now. There are determinants of health that is totally out of our control, and yet we're trying to do everything within the same model, 10 to 15 minute GP consultations that are kind of programmed for us. And so in regards to your question about alienation or trying to keep GPs within the system, I think we really need to listen to sort of the diversity within our profession, and come together and realize that, just like healthy natural ecosystems are made up of so many different plants and lichens and rocks and, lots of interconnectedness, we need to start treating the healthcare system a bit like that, and not have a one size fits all model, which is where I can't thrive currently as a new GP. Yeah, I have some ideas for sort of systemic change, which obviously it's very difficult when you're so early on in your profession to sort of think about how do we actually get that sort of policy change happening. But it's certainly something that I have a lot of ideas about.
Well, fortunately, that was my next question. So, we can use this platform to discuss some of your ideas around systemic change. And of course, I'd love to hear what Ru and Jens had to say about this as well. Just to add, though, we've been recording a series of these podcasts now for the past few months in collaboration with Ru and Jens. And obviously, I've spent quite a lot of time reading the book, Fighting for the Soul of General Practice. And I keep encountering the same things and the same concerns from very different people with different perspectives from the healthcare profession. So it's this idea of homogeneity doesn't seem like a good one, and I keep hearing that we need to be building relationships, and technology being misused and affecting doctors and creating more stress rather than creating solutions in many instances. And so it's interesting to hear these different things come up in different perspectives. So let's think about systemic change. Here's your opportunity, Emma. So perhaps you could give me a few, maybe up to 3 things that you would like to see changed.
Well, I think continuing from what I was talking about, I think we need to move away from that one size fits all model of general practice, and maybe try and think about more hybrid models. I'm part of a small network of GPs that now call ourselves slow GPs, but almost with a sense of pride, because in the past I used to feel very inadequate or like I was failing because I'd constantly be staying late. I think that it's hard to sort of deal with some of our patients in that 10-minute model. So I think we need to have different streams, different types of clinics, depending on the personality of the doctor, but also the patients that are coming through. So slower clinics, faster clinics, and hybrid models. I think we really need to think about, group consultations. And personally, I think we need to start taking care out into the community and not having it just within the building of the general practice itself. I've been involved with charities that do a lot of work out in nature for mental health sort of work, and it's been extremely humbling and an experience to actually walk and talk with people who have had profound changes to their mental health by being taken out into natural settings. And so I think we need to start thinking about more creative ways that we can do general practice. Obviously, that is quite idealistic at the moment with a lot of regulation, etc., which probably leads to, I think we need to think about how we can remove some of the intense regulation and bureaucratic red tape that stops a lot of these experiments from happening quite easily. I certainly during my training wanted to do quite a simple quality improvement project where I took basically 10 mental health patients out into a natural setting. It was really, really simple. There was nothing too complex about it, but I was essentially put off because of the amount of red tape and hoop jumping I would have to go through to get this approved. which put me off. And I just started to think about how much innovation and creativity is being stifled within the NHS because we don't have the headspace on top of our kind of current day jobs to be doing projects like this. So that's one or two systemic changes. I also think we really need to support and be flexible about career gaps in medicine. It is one of the reasons that I haven't left clinical medicine, and I think I was very close to leaving clinical medicine. So with the current levels of, the exodus, so to speak, or the very high attrition rates that are going on right now, the brain drain that is occurring from our healthcare system to other countries and out of medicine entirely, I think we need to now just say, okay, we need to actually normalize unpaid leave, sabbaticals, career gaps, because I think that gives permission to that person to rest, recover, and find a sense of purpose and meaning in however way they want. They will still be a good doctor, if not a better doctor at the end of it. But thinking about how we can support that, and that's one of the projects that I'm working on at the moment, normalizing mini sabbaticals, normalizing job swapping for those doctors who are probably on their way to long-term sick leave or leaving the profession. And I just know too many of my colleagues, both in, doctors and allied health professionals, who have sadly now left. And if this was offered to them, maybe things would be different. And yeah, I think taking care out into the community, I think, is so important. There's some amazing pilots that have been going on around the country, particularly in Sheffield. There's an integrated neighbourhood app network called Hero of Health, where they basically have taken sort of lifestyle medicine, walking, talking, nutritional support with GPs and patients out into the community. It starts running itself. It becomes very peer-led, and they've had amazing results regarding reductions in GP presentation, saving money for GP practices in kind of by reversing chronic diseases. So I think we need to really start looking at different models like that and how we can sort of hybrid between community and general practice.
Thank you, Emma. I like a pragmatic solution, and you've given us a few there. Thank you very much. Now, of course, Ru and Jens, I'd love to hear your take on either on what Emma's just shared with us, or of course, any of your own suggestions.
A lot of what Emma says really resonates. I love the idea of fast and slow clinics, about moving care into the community, about questioning the overinflation of medicine when so often it's not medications or medical interventions which are going to be the most helpful thing for people. So I'd say let's rethink our conception of efficiency. So I think there's a bit of conflation at the moment that you're a good GP if you can get through, to hate that term, clinic of patients as quickly as possible and not overrun. And I would challenge that. I don't think that being able to do that is the same as being a good GP. So let's kind of rethink. Let's allow some space for unhurried, careful conversations where the patient is at the center and everything that matters to them, their context, is really taken into account. Let's create some spaces where we can talk about this, where we can talk about those moral moments in consultations where there's a bifurcation points where you can make different decisions. I can choose to write the letter for this patient sitting in front of me who's got a problem with their housing. I can choose to spend a little bit longer. I can choose to acknowledge that they look upset, or I might not. And I think kind of actually reflecting on why I chose what I chose, what we do as a community of practice, allowing that sort of space will make for better care, kinder care, and care that's more compassionate to each other as well as to patients. I think we definitely need to rethink the number of targets and other distractions that come between us and our patients, and just make sure it's worth it.
Both what you say resonates with what I'm pursuing, what I always pursued, and what I'm still doing, reaching out in the community, having sessions about pain in the library, having different conversations which are not just in these 10 minutes pressured in the closet with me. No, I don't want that. And it's too narrow. I want to move away and have more creative spaces And possibly that needs to have a way where it's not all dictated by data entry. What have you done and who has said what and where does it feed where? I've done lots of experiments with this also in the last job. And if there are other people in the practice who support that and that things are possible, group consultations, great idea, but again, it needs to sit somewhere and needs the kind of generosity amongst each other that makes that happen. We also could plan our day differently. I'm an appraiser, so I heard from an appraisee, anything after 4 o'clock, sorry, I can't do it anymore. So why don't we accept that and saying, let's bring difficult people or difficult, challenging situations when your biorhythm is okay for it, and have other bits which can be maybe 5 minutes, 7 minutes when your mind is frazzled. That should be possible if you are a little bit more flexible. Why does everything need to be the same? The numbers of consultation doesn't reflect the intensity of or the emotional labor. I can go easily through a locum list, no problem. I'm not challenged. But so we need to find this, or I see situations where being generous with each other is possible if you're talking to each other, if you're flexible with the clinical system, and if you're married, or if you refer to that magical moment, or you say moral moment, or the something that shifts and makes me happy in caring for people. And this happiness is always still there. Maybe when you're so bogged down by the drudgery, you don't see the little flower, which may be a weed, and that makes you happy, but it's there.
Well, thank you all. That's great to hear these potential solutions. I think it's really nice to have a podcast where we're actually coming up with some practical solutions potentially for some of these challenges. Now, following on from that, I think it would be really interesting to hear your points about what we can do to keep general practice relevant and meaningful as a career over the coming decades. How do you all feel about that? Do you still feel that this is a career that entices people? Or do you think people are being turned away or don't or are not potentially engaging with it at all anymore? Emma, how about you? You're most recently sort of gone through the training process. How do you feel about that, and how can we keep it relevant?
How can we keep it relevant? Well, I like to talk about nature, so I always use analogies, but we could rewild GP and start thinking. I don't know, I think it does need to be a collective movement where we all kind of demand change, really. I think it's sort of all these changes, I don't know because I haven't worked in it myself, but it seems like they've slowly been crept up upon us, and we haven't really had a chance to sort of really question whether it's right, particularly with like the target-based stuff, and I think it's going to take a collective movement of passionate general practitioners to sort of come together and say, we're going to rewild and do something different. It's very difficult when obviously, that's very idealistic. Our funding comes from the government. I've only been a doctor in the Tory government, so I haven't experienced anything different. But I think primary care has always been family medicine, been sort of within the community, and we need to start thinking about that again and being that. I want to see primary care being a hub or an interface, between lots of different systems, and not just the acute hospital system, but actually integrating with lots of other systems, whether that be community centers, yoga, kind of more holistic health, community kitchens, just lots and lots of different ways of doing healthcare or well-being, really, that sort of all integrate together. That's how I sort of envision a nicer model for primary care in the future. But I don't know if that's just healthcare utopia at the moment. But I think it's just going to take a lot of passionate GPs collectively mobilizing together.
Well, it also seems that these are challenges that are facing many professions that rely upon people being very much dedicated to their career. Things like teaching, things, many of the authors I work with who are different kind of doctors, but, who are working in the arts, humanities, or the sciences, and they're no longer getting tenure, or they're no longer having job security and things of that nature as well. So this seems like, talking about systemic change, it seems like this is beyond the healthcare profession as well. Ru, what about you? Do you have anything to say about this?
I love the idea of rewilding general practice.
Yeah.
I fully, I'm kind of at risk of just agreeing with everything that's been said. I think it definitely applies to other professions. This is not a phenomenon that's isolated to healthcare by any means. You see it all over the place, and it's kind of an over-reliance of wanting to standardize everything, of wanting to measure everything, to kind of have outcomes and targets and reduce. It's very reductive, isn't it? You want to reduce the kind of complexity of human interactions. I think there's a tendency to want to reduce complexity, and we probably need to embrace complexity, to embrace relationships, and to value them.
I like that, the idea of embracing complexity. I think we could all learn a bit from that, actually.
Yeah, I would like to be more practical and more visionary at the same time. I want to be closer to managers, having a shared understanding what we are doing, knowing that we have technologies that capture so much, that we live in this kind of world, but have maybe mechanisms to have less infight, less friction, less stupidity, less measuring everything without knowing what to do. As, for example, as program director for our VTS, we always have to collect feedback. Fantastic. But have we ever done anything about it? No. So why do we do it if we don't do anything about it? So many things. So the first thing is probably having more dialogue with the management systems, because are the managers happy? No, they are not. They are stressed out, burnt out, demoralized, reaching out, and in the little environments we have, and strengthening relationships. That's probably the same like what you say, Emma, about relationships in the community. And when we had our book launch, what I found interesting were two older doctors who have retired. One said there was never a golden age, and having managed care is really, really good. I think about and he had an abbreviation like scroungers, lazy people, incompetent people. That has changed. We are more organized. And the other one said we were more embedded with relationships to hospitals, with relationships to patients, and possibly less alienated. And I thought, that would work for me. I would be quite happy if I'm a GP, less alienated, serving the community, working hard. That would be okay for me. I'd like that.
Well, it's interesting that came from the book launch, which you just held recently, because it sounds like these opportunities for you doctors of different generations to get together in the same room and actually have the time and the bandwidth to discuss these issues would be a really positive step forward from my outsider perspective. And I'm glad that the book has been able to provide an opportunity in some way, shape, or form through the launch to get a bunch of you in the same room to discuss through some of these issues.
It did.
Yeah, I think we really need a conversation amongst the profession, as Emma says, to reimagine it.
Well, I want to thank all of you very much for your time and contributions today. But before I sign off, are there any final thoughts from any of you panelists?
I still love being a GP, James. These moments of connection that you get are priceless, and we mustn't let them get stamped out.
Yeah, again, I'm not in the healthcare profession, but as someone who has to visit my GP, it's obviously those relationships have changed since I was a child. Being 40 now, but it's still an important relationship, and one that I'm truly lucky to have. So I think, you know, going back to the core and rebuilding these relationships, finding ways to generate new ones, and discussion around that is really important. And it's great to hear you say that you still love being a GP, because we love having you, you know. So as customers, as it were, we really do appreciate all the work that you do. And you know, it just amazes me as a publisher, working with many different professions and professionals, practitioners, scholars from across different walks of life and disciplines, is how productive you all are at writing and producing all these books, journal articles, fantastic contributions to the field, while you're all practicing GPs. It blows my mind. So, you know, thank you very much for all your contributions, the many and multifaceted ones that they are. And thank you all again for your time today. I really appreciate you spending time discussing these issues. So thank you for joining me on In Conversation. It's been a pleasure. Ru and Jens, I'll see you again soon for another installment. And Emma, it was wonderful having you as a guest. So thank you all for your time.
Thank you so much, James. Thank you, Emma.
Thank you. Thank you.
Thank you so much.